All are true about starting of P blocker therapy in a case of congestive heart failure, except they should be started with optimal doses. So, what is true is they should be gradually increased over week. Special precautions should be taken in cases of NYHA class 3 and 4. Carvedilol and metoprolol are the preferred drugs. Which of the following is the best ionotrope agent for use in right heart failure secondary to pulmonary hypertension? Milrinone. Drugs used in chronic heart failure. All are true about starting of beta blocker therapy in a case of congestive heart failure, except they should be started with optimal doses. So what is true is they should be gradually increased over week. Special precaution should be taken in case of NYHA class 3 and 4. Carvedilol and metoprolol are the preferred drugs. Which of the following is the best ionotrope agent for use in right heart failure secondary to pulmonary hypertension? Milrinone. Which is increased in plasma of chronic heart disease patients? BNP. All of the following are used in the initial management of acute life-threatening cardiogenic pulmonary edema except digoxin. Morphine, furosemide, and positive pressure ventilation is used in the initial management of life-threatening cardiogenic pulmonary edema. Digitalis. All of the following statement about digitalis are true except excretion is mainly renal. So what is true is oral absorption is good, actively metabolized in liver and lipid soluble. All of the following electrocardiographic findings may represent manifestation of digitalis intoxication except atrial flutter. So bigeminy and junctional tachycardia and atrial tachycardia with variable block are the manifestations of digitalis. All of the following statement about digoxin induced arrhythmias are true except biventricular tachycardia. So true about digoxin induced arrhythmia is paroxysmal atrial tachycardia with variable AV block, ventricular bigeminy, and may be used to atrial fibrillation. True statement regarding atrioventricular block with atrial tachycardia is seen in digitalis toxicity with potassium depletion. Digoxin toxicity is enhanced by all except hepatic dysfunction. Digoxin toxicity is enhanced by quinidine, hyperkalemia, and hypomagnesemia. All of the following may precipitate digitalis toxicity except hypocalcemia. Hypokalemia, hypomagnesemia, and hypothyroidism may precipitate digitalis toxicity. Digitalis toxicity enhanced by all except hyperkalemia. Renal failure, hypercalcemia, and hypomagnesemia can enhance digitalis toxicity. Following are used in treatment of digitalis toxicity except hemodialysis. Potassium, lignocaine, and Fab particles are used in treatment of digitalis toxicity. Treatment of digoxin overdose includes administration of all of the following except hemodialysis. Potassium, lignocaine, and phenytoin is used for treatment of digoxin overdose. Digoxin is used in the treatment of atrial fibrillation. First symptom of digoxin overdose is GIT disturbance. The following agents may be used as prophylaxis in high altitude pulmonary edema. Digoxin. All of the following statement about digoxin induced arrhythmias are true except biventricular tachycardia. So true is paroxysmal atrial tachycardia with variable AV block, ventricular bigeminy, and may be used to atrial fibrillation. Digoxin is contraindicated in hypertrophic cardiomyopathy. Low renin is seen in all except renovascular hypertension. So low renin is seen in essential hypertension, Cone syndrome, and Liddle syndrome. Increased renin activity is seen in malignant nephrosclerosis. Non-modifiable risk factor for hypertension is gender, obesity, salt intake, and cultural characteristic acquired. Chief time is modifiable. Hypertension, most common cause of renal artery stenosis in young adult in India is non-specific aortoaortitis. Renal artery stenosis may occur in all of the following except polyarteritis nodosa. Renal artery stenosis may occur in atherosclerosis, fibromuscular dysplasia, and Takayasu's arteritis. Angiographically, the typical beaded or pile or plates appearance involving the internal carotid artery is seen in fibromuscular dysplasia. A 20-year female has bilateral bruit on flank. Her blood pressure is 160 by 110. Which of the following statement is correct? Enalapril deteriorates renal function. Most definitive diagnostic procedure is contrast enhanced arteriography. Surgical intervention may be used. Fibromuscular dysplasia is a common cause in this patient. Commonest cause of sustained severe hypertension in children is renal parenchyma disease. Monogenic and autosomal dominant cause of hypertension is pregnancy induced hypertension, glucocorticoid remediable hyperaldosteronism. In essential hypertension, changes seen in the heart are cardiac cell hypertrophy. Which of the following is most specific and sensitive screening test in a case of renovascular hypertension? MRI. Quick reduction of blood pressure is done in hypertensive encephalopathy. A person has headache and profuse sweating. On examination, his blood pressure is 200 by 120 mm of mercury. Which of the following should not be used? Nifedipine, phenoxybenzoamine, and methyl dopa should not be used. Sodium nitroprusside or labetalol can be used. A young patient presented with blood pressure of 190 by 120 mm of mercury without any clinical symptom and fundus examination is normal. Treatment of choice is oral enalapril. All of the following drug can be used in hypertensive emergency: IV hydralazine, indapamide, and sublingual nifedipine. All of the following are used intravenous therapy for hypertensive emergencies except nifedipine. A hypertensive diabetic is having proteinuria. Antihypertensive of choice is enalapril. All of the following drug combinations may be recommended for initial management of hypertension except ACE inhibitor and beta blocker. In accelerated hypertension, what is the metabolic defect? Metabolic alkalosis. An elderly patient with hypertension with diabetes, proteinuria without renal failure, antihypertensive of choice is enalapril. In primary pulmonary hypertension, basic abnormality in gene lies in bone morphogenetic protein receptor 2. Pulmonary hypertension may occur in all of the following conditions except Argemone mexicana poisoning. Pulmonary hypertension may occur in toxic oil syndrome, progressive systemic sclerosis, and sickle cell anemia. Pulmonary hypertension is caused by interstitial lung disease, myocardial infarction, and thromboembolism. All are causes of pulmonary hypertension except hyperventilation. Morbid obesity, high altitude, and fenfluramine are the causes of pulmonary hypertension. Pulmonary hypertension in COPD is due to constriction of pulmonary vessels, not seen in precapillary pulmonary hypertension, increased pulmonary wedge pressure, which is a feature of high altitude pulmonary edema associated with pulmonary hypertension. All are used for treating pulmonary hypertension except beta blockers. Endothelin receptors antagonist and phosphodiesterase inhibitor, calcium channel blocker are used in treatment of pulmonary hypertension. Which drug is not used in pulmonary hypertension? Alpha blocker is not used. Manifestation of aortic dissection are pericardial effusion, aortic regurgitation, acute myocardial infarction, and limb ischemia. Aortic dissection is associated with systemic hypertension, coarctation of aorta, Takayasu arteritis, and Marfan syndrome. A 50-year-old male patient, an alcoholic and smoker, presents with a 3-hour history of severe retrosternal chest pain and increasing shortness of breath. He started having this pain while eating, which was constant and radiated to the back and interscapular region. He was a known hypertensive. On examination, he was cold and clammy, with a heart rate of 130 per minute and a blood pressure of 80 by 40 mm of mercury. Jugular venous pressure was normal. All peripheral pulses were present and equal. Breath sound were decreased at the left lung base and chest x-ray showed left pleural effusion. What is the most likely diagnosis? Acute aortic dissection. In aortic dissection, drug used are propranolol, sodium nitroprusside, and labetalol. Renin plays important role in renovascular hypertension. Ideal imaging modality for renal arterial hypertension is angiography. Which one of the following is of most serious prognostic significance in a patient of essential hypertension, papilloedema, and progressive renal failure. In benign hypertension, commonest vascular pathology is hyaline arteriosclerosis. All of the following are feature of malignant hypertension except respiratory failure. In essential hypertension, the drug prescribed with least cardiovascular effect is ACE inhibitor. Calcium blocking agent of use in the treatment of hypertension include nifedipine. Which of the following drug should not be used in a setting of severe hypertension in elderly on empirical basis? Prazosin. Cause of secondary hypertension includes renal parenchymal disease, pregnancy-induced hypertension, hypothyroidism, or hyperthyroidism. Enalapril use is not advisable in the following conditions except diabetic nephropathy with albuminuria. Enalapril can be used. In case of single kidney, bilateral renal artery stenosis, or hyperkalemia, enalapril is not advisable. Shock. Characteristic of SIRS include the following except thrombocytopenia. So characteristic of SIRS include leukocytosis, infectious or non-infectious cause, oral temperature more than 38 degrees centigrade. Features of shock: decreased glomerular filtration rate, increased renin, and increased lactate. In gram-negative septicemia, early finding setting before shock of fluid is increased cardiac output, increased total peripheral resistance. Early sepsis is characterized by all except bradycardia, sweating, and cold extremities. True statement about sepsis and septic shock is it is commonest cause of death in surgical patient. Main treatment is infection site, leads to organ dysfunction, and best fluid is normal saline or ringer lactate. A 70-year-old man develops pneumonia and septicemia. Patient goes into renal failure and has a blood pressure of 70 by 50 mm of mercury. Drug that should be used to maintain blood pressure is norepinephrine. True statement about shock is during dehydration, both ICF and ECF volume decreases. 10 to 20% of fluid loss is compatible to life. Early change in shock is increased release of noradrenaline. Hemorrhage cause intravascular fluid loss. In cardiac shock, systolic blood pressure less than 90 mm of mercury. Feature of septic shock is acute tubular necrosis. A patient in ICU has normal pulmonary artery pressure, low systemic peripheral resistance, low cardiac index, arterial oxygen saturation is 93. Diagnostic possibilities are cardiac tamponade. A patient presented with shock and suspecting it due to hypoglycemia, the treatment should be based on blood sugar IVSS. Which test is not useful in a patient with a history of syncopal attack? PET scan. Electrophysiological test, table tilt test, and Holter monitoring test is useful in a patient with a history of syncopal attack. Neurocardiogenic syncope, the least useful investigation is carotid duplex scan. Tilt table, carotid sinus massage, and orthostatic blood pressure recording is useful. A 40-year-old presenting with dizziness on standing with systolic reduction of blood pressure of 50 mm of mercury, appropriate treatment is graded compression stockings, fluodocortisone. A 42-year man presenting with dizziness on standing and systolic blood pressure falls by 50 mm of mercury, gradual stockings and compression, and fluorocortisone is advisable. 42 years old man presented with dizziness on standing, systolic blood pressure fall by 50 mm of mercury, and heart rate is 52 per minute. Likely cause is inferior wall myocardial infarction and sick sinus syndrome. A patient with diabetes mellitus of 4-year duration presents with dizziness and heart rate 52 per minute. Probable cause is inferior wall myocardial infarction, sick sinus syndrome, or autonomic dysfunction. Sudden cardiac death may occur in all of the following except ventricular septal defect. Sudden cardiac death may occur in dilated cardiomyopathy, hypertrophic cardiomyopathy, and Eisen-Menger syndrome. Which of the following is used in resuscitation? Epinephrine, oxygen, lignocaine, and magnesium is used. Norepinephrine is not used. True regarding cardiopulmonary resuscitation is adrenaline is given if cardioversion fails. In basic life support (BLS), support is given to which of the following organ? Lungs, heart, and brain. In cardiopulmonary resuscitation, calcium can be given in all except hypokalemia. Calcium can be given in hypocalcemia, hyperkalemia, and calcium channel blocker. What would be the first line of treatment if in a patient develops ventricular fibrillation after intravenous injection of potassium chloride, defibrillation? Which of the following is included in the treatment of ventricular fibrillation and subsequent cardiac arrest? Epinephrine, antiarrhythmic agent, and vasopressin. During cardiopulmonary resuscitation, intravenous calcium gluconate is indicated under all of the following circumstances except after 1 minute of arrest routinely. So, during cardiopulmonary resuscitation, intravenous calcium gluconate is indicated during hypocalcemia, calcium channel blockers toxicity, and electromechanical dissociation. Immediate treatment of peripheral circulatory failure in dengue shock syndrome is IV dextrose saline and IV crystalloid infusion. Hypovolemic shock is seen in all except starvation. Hypovolemic shock is seen in hemorrhage, vomiting, and diarrhea. The regional arterial resistance of the mesentery and kidney vessels is reduced by dopamine. 40% loss of blood volume in a patient is managed by saline infusion. In shock, all happens except heart rate decrease. So, during shock, constriction of capacitance vessels, dilatation of arterioles, and decrease in cardiac output. Acute physiology and chronic health evaluation. Apache scoring system is used as a scoring system to evaluate prognosis in the critical care setting. Which of the following drug is not recommended in septic shock? Steroid is not recommended in septic shock. Normal saline, activated protein C, and rituximab is indicated in septic shock. Dengue shock syndrome occurs due to capillary leak.